All right, I'm going to get started because we have a great amount of information to get to today. And so, again, welcome everyone. Good afternoon. My name is Julie Tesh, and I'm the president and CEO of the Center for Rural Policy and Development. We are in our fifth year of working with the Citizens League, doing these interconnected series on, and we started this because there's so many issues that are common between urban and rural audiences, whether that's childcare, healthcare, mental health. We've had really good discussions in the past. And just to let you know a little bit about the Center for Rural Policy and Development, we're a nonpartisan, not-for-profit policy research organization. We specifically focus on Minnesota, and we provide its policymakers with unbiased information and evaluation of issues from a rural perspective. I encourage you all to go to our website, ruralmn.org, and that is where this recording will be, and it will also be on our YouTube channel as well in the coming days. But want to again thank you and thinking about how rural Minnesota is changing. We all know it's changing across its small towns, its open landscapes. People of color are becoming a larger part of the community. Some are newly arrived from other countries, and others whose family have called this region home for generations. You can check out our previous research, and actually, this webinar is based off of research we released last November, so make sure to go check it out. But finding help for mental health concerns is a struggle for anyone, especially in rural areas, but it can be even harder for people of color. And so, whether they're recent immigrants trying to navigate unfamiliar systems or longtime Minnesotans, um, finding accessible mental health services to meet their needs is significant. And so we also have a shortage of mental health providers and services. And so I am excited. Maybe excited is not the right word, but I'm 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 happy to be sharing with you. We're happy to be sharing with you today this report. And I'm going to introduce Mitra. She is one of our contract researchers who worked arduously on this project. And like I said, if you would like to access this report, I believe it's 28 or 38 pages long. You can go to our website at ruralmn.org and you can access it from there. If you are participating, if you would like to ask questions, we ask that you please put them in the chat. We will be monitoring that and asking our presenters, and there's Marnie. If you have any questions, please put it in the chat. We'll be monitoring that. And Mitra, if you want to turn your camera on.
Good
All
morning,
right.
everyone.
Awesome. So I'm going to turn it over to Mitra Milani Engan, who we've had the privilege of working on this report, brings a great wealth of knowledge, great expertise, and really, okay. Is anyone else hearing an echo?
I'm not.
No. Okay. Okay. Thank you all for letting us know that. So like I said, if you have a question, put it in the chat. We will be putting this on our website and on our YouTube page, and it is my pleasure to turn it over to Mitra.
Thanks very much, Julie. Um, it was a great privilege for me to be able to work on this project. It was a 2-year process that consisted of many interviews, many conversations with community members and healthcare providers, administrators across rural Minnesota. And the focus of this was to investigate two things. First of all, what are the barriers to mental health care access for communities of color in rural Minnesota? And second, what are the emerging community-driven solutions to bridge these barriers? Either solutions that are already being pioneered in Minnesota and meeting with success, and also ideas that are being innovated and pioneered in other parts of the country that could be applied here in Minnesota. So without further ado, I will share my screen. Let's see here. Is this looking good for everyone?
Looks great.
Okay. Now I need to find my Zoom screen, which, oh goodness. Well, where did that go? I am going to dive right in. There it is. Now I find all my screens. So, um, diving right in, we have, first, let's look at the big picture. With 82% of mental health care providers living or working in large metro areas, there is a stark geographic disparity. Supply of mental health care practitioners and organizations decreases steadily as population density goes down. This means that in large metro areas, there is one provider for every 197 residents. But once you get to rural areas, this dives to one provider for every 741 people. Now, this is the effect on rural Minnesota as a whole. And so the question now becomes, how does this compounding effect impact communities of color in rural Minnesota? So to get the picture of that, first let's look at demographic changes that we've experienced since 1980. We are becoming increasingly diverse. 14% of rural Minnesotans are now people of color, reflecting a dynamic demographic shift away from historical homogeneity. Yet provider shortages are even more acute for communities of color, where cultural representation is nearly non-existent in localized clinics. Access to mental health care, as we all know, is a critical pillar of foundational community well-being. So let's take a look, let's drill down to look at the processes and dynamics that are at play here. There are a number of barriers that were discovered through the process of this study. Some of these affect all rural Minnesotans and are easier to understand on the surface. For example, the overall cost of healthcare is a problem for everyone. Public transit in rural areas is either minimal or non-existent. Broadband access, which is necessary for telehealth, is also not available at all or is not available reliably in many rural areas. Next, let's look at barriers that are specific to communities of color. These barriers are disproportionate or unique to communities of color and immigrants. They are sometimes harder for mainstream audiences to grasp. So let's elaborate on them over the next few slides. First of all, one of the barriers easiest to see and understand is the lack of licensed mental health care providers who are also people of color. One of the people I interviewed for this study was Eric Sievers, who is the executive director of Hiawatha Valley Mental Health Center, which serves a population of about 160,000 in 5 rural counties in southeastern Minnesota. He said, we're an agency of about 100 or so. We have one provider who's not a white person. One, he said. He went on to say, about 6% of the region's population are people of color. We are grossly underserving that population. This is compounded by the lack of providers who reflect a culture that isn't white or English speaking. Now, you may be asking, how does lack of representation affect mental health care access and outcomes? Let's look at an example to help illustrate a few of the issues at play here. In this example, a 25-year-old Latino man from a close-knit, multi-generational family is living with his parents and grandparents, and he expresses feeling torn between family obligations and his desire for independence. Let's say he has a therapist who's a white clinician raised in a Western individualistic culture that prizes autonomy, personal boundaries, and self-determination. and the vast majority of providers are white, especially in rural Minnesota. This is an example, a common example of cultural mismatch. A white therapist may interpret this client's strong family ties as unhealthy dependency or boundary issues. They may even diagnose enmeshment or, in other ways, pathologize what is truly a healthy collectivist expression of love, loyalty, and support. Now, this is not just a communication gap, it's a diagnostic one. Without cultural attunement, values get pathologized as symptoms. Um, hmm. Pardon me, technology issues for a moment there. Um, let's see here. Yes. So we have a problem with a licensing bottleneck. State regulations require passing these national exams, which have documented systemic pass rate disparities. Now, there is a growing nationwide movement to overhaul licensing as it severely restricts BIPOC entry to this industry. The next barrier it's important to discuss is stigma and fear. One of the, this is a big topic and a complex one. I can't do the subject justice here, and there is a lot more detail provided about this issue in the report, so please do read it for more details. There is a legacy of trauma and skepticism. Our country has a well-documented history of medical abuses, especially when it comes to communities of color. This quote is simply another example of one of the reasons that there is stigma and fear. Unfortunately, historical contexts like boarding schools, medical exploitation, and legal outcomes for calling 911 during mental health crises inform today's rational skepticism. The consequence is that many people of color, especially African Americans and Native Americans, view the current medical system with caution, skepticism, and fear. When I interviewed a middle school social worker in Sauk Rapids, he shared, as a person of color, you're looking for someone you can relate to, someone that can understand your culture, because a lot of times in smaller towns, you feel isolated. For people who are both people of color and new immigrants, language barriers further compound the barriers. There is a chronic shortage of language interpreters in rural Minnesota, especially for languages with multiple dialects like Spanish. To further paint the picture, this shortage sometimes leads to relying on family members for interpreting, which, as you can imagine, can significantly reduce patients' comfort and candor in mental health care settings. Now let's segue to talk about some of the solutions that bridge the barriers we've discussed so far. And these solutions were gleaned from interviews with the participants in this study. And overall, it's important to emphasize that cultural communities possess inherent resilience and solutions that make the most sense in their cultural communities. Successful models are designed locally and not imported from urban academic environments. This is one of the themes that will come up more in the balance of this presentation. Here are two examples of community-driven solutions that are found in Minnesota. These shift mental health care to a larger focused family and community care lens. These programs provide services in ways that better build trust and access. There are more details than can be discussed in this slide, but again, please refer to the study for more details on these and other examples. And also you can reference the official White Earth Nation website for more information on the White Earth Moms program. One of the bridges being built that needs a significant amount of more attention is how the licensure pipeline. The Minnesota legislature is relaxing standard licensing bottlenecks for groups with documented disadvantages while emphasizing on-the-job training models to diversify the workforce. One of the suggestions I heard from a mental health care provider in Willmar, Minnesota, was to allow hands-on learning pathways to rapidly and effectively expand the active labor pool like we find in the trades. Another bridge that was discussed that is being pioneered in a few communities around Minnesota and also in communities all over the country with a significant level of success is co-responder teams, where first responders like police officers, emergency medical staff are riding along with social workers to respond to calls in the community. And what this results in is, better likelihood of people receiving appropriate care, and it helps mitigate fear of criminal charges, and just make sure people are getting the help they really need at the right time in the right places. Another issue is telehealth, which with enhanced broadband connectivity, which is in progress in rural Minnesota and still needs a lot of work, telehealth can mitigate access shortages, especially for communities of color, especially for those that need language interpreter services. So let's summarize what we've been looking at here. We have some key actions that have been called out by this study. One is that we need to address stigma, and this is true across all cultural and language and racial groups. The amount of stigma that still is associated with mental health and mental health care is significant. So we do need to continue making it okay, culturally okay, to talk about mental health. Focusing on connection and community-driven solutions is critically important. Coordination of efforts between agencies in medical, government, and community organizations yields to significantly better outcomes. We need to reform the licensure process and provide more paths to licensure to provide a mental health care cadre of providers that are more representative of our demographics in rural Minnesota. And finally, we need more research. This current study is one of the few or only that we are aware of on this topic. So more research is certainly needed. At this time, I would like to conclude this more formal portion of the presentation and move into question and answer and input from the panelists who are experts in their fields. Take it away, Kate.
Thanks so much, Mitra. Yes, and thank you everyone for joining us today. I'm Kate Raditz with McClung PR. I will be the moderator for today's discussion. I'll have all of our panelists who will be answering some of the questions I've prepared and then answering some of your questions if you have them as well. You can go ahead and turn your cameras on, panelists. I'm going to introduce our panel, and then, like I said, we'll jump into questions. I will be monitoring the chat. If there are any questions, I'll try to take a break from time to time. I have prepared quite a few questions, and I'll try to get those in to our panelists as well. So first, you already heard from Mitra, Milani, Engan, a consultant and researcher. We also have Pablo Obregon, Director of Community Growth for the City of Willmar. Katya Zepeda, Director of Advocacy for St. Paul and Minnesota Foundation. And Veronica Rivera, licensed independent clinical social worker and psychotherapist. And with that, we can go ahead and get started. And the first question, I'll ask all of you to respond, and you can say hello. First, why is this conversation especially important right now in Minnesota, particularly for BIPOC communities in both rural and urban areas? And Katya, maybe can we start with you?
Sure. Thank you, Kate. Thank you for that question. Good afternoon, everyone. Thank you for being here. I would say that it's always been important. It's not just now, it's been always. It's just that we're now starting to be more open about talking about this issue. Also, we are now into, especially in some parts of greater Minnesota, you're in the second generation, third generation of BIPOC community. So therefore, they have some knowledge of what that system looks like because they're starting to talk about it in school as well. So I feel that that's what's contributed to the awareness and the more opening of like why we need to discuss mental health in our communities. So I would feel that it's always been important, and especially now with all of the different things that have been happening in our communities with the school shootings that have impacted our youth. The murder of George Floyd has impacted. It didn't just stay in the Twin Cities, it had an impact in greater Minnesota as well. And now with ICE on has always been a threat for our Latina community. This isn't something that has happened now. Like I remember in the 90s, especially if you where grew up, which was in Northwest Minnesota, it was common to see Border Patrol agents driving down the highway. So it's not something that isn't new to us, but it is something that has had more of a lens on us. And so I feel that that's what's brought it up more to the attention. But the trauma has always been there, and it's just been exacerbated by social media as well, because now you just can't get away from it. There's no safe space for you to just remove yourself from it. You can't turn it off like other folks can.
Thank you so much. Pablo.
Yeah, hello everybody. Good to be here sharing some of the thoughts from this part of Minnesota. I'm in Willmar. And I guess I agree with Katya with all the different reasons what she has shared. Maybe in addition to that, I think it's important to see every human being as in a holistic approach. So, and that is when a stigma sometimes comes because in many cultures or in economical status, sometimes that differs and that isolates people from dealing with an entire holistic approach in a human person. So I think, so like Katya said, nowadays there is a very intense mental health um, uh, moment that many people are living because of the surge that happened in Minnesota. And we need to make sure that we have learned lessons from the past. So I go back to COVID, where it was a time where a lot of people became very isolated. With Metro Search, BIPOC community especially have been pushed into our homes and behind four walls, and we need to make sure that we are starting to provide ways to deal with that isolation in our BIPOC communities.
Thank you. Veronica.
Thank you, Kate. Hi, Mitra, thank you so much for that research that clearly reflects what is happening in the community. So for this conversation is urgent because Minnesota is changing fast, but our mental health system is stuck in the past. In rural Minnesota, the number of Black, Latino, and Indigenous residents has grown a lot. In some counties like Nobles and Manomin, close to half of the population are people of color now, but almost 90% of our licensed therapists in Minnesota are white. So the math just does not work. And at the same time, there are a big disconnect. Big clinics have a long waiting list. They hold into clients for months, even when they don't have therapists who understand the client's culture or language. Instead of sending these clients to small, specialized private practices that have openings, and they keep them waiting. And in mental health, a long waiting list is not just a delay. It means that people do not have care at all.
Thank you. And finally, Mitra.
I'm sorry, repeat the question.
Yes, I was just saying, why is this conversation especially important in Minnesota right now?
I really, the people that spoke already have really spoken to it very eloquently. I don't need to add anything.
Then I'll continue. Pablo, from your work in Willmar, what are the biggest barriers underrepresented residents face when trying to access, mental health care?
Yeah, I think there is many of those barriers. They have been mentioned already in the presentation and in the document, so I encourage everyone to go to that. But maybe a couple of highlights on that. It's the fact that there is still the stigma on mental health. People, number one, being in rural Minnesota, that means that you know your neighbor or your neighbor's kids, and kids are friends, or you attend church with the providers, or vice versa. And the stigma then becomes very high because then you want to protect yourself so that others don't see you walking into the different mental health care facilities or providers. Myself as a professional, I remember when I seek mental health aid in the past, it took me a long time for me to take that first step to recognize that in this culture, mental health is just another part of my whole being, and that I needed to take care of that part of my life. So even a person that was educated with some type of a secure income and things like that, it was difficult in many of our communities, especially new immigrants that don't understand the health system. Sometimes that's a very high stigma, and how they break that and how we break that, it has to be a communal effort. And one last thing, because I don't want to keep chewing the same thing, there's a financial barrier, which is a lot of people work in manufacturers, factories, line work type, and the type of insurance many of they receive, the deductibles are super high.
Mhm.
Therefore, it is hard for them to make those payments for them to be able to pay their mental health services because they're just living from paycheck to paycheck with the basic needs, such as paying for housing or the kids' education and so forth.
Got it. Veronica, as a therapist working with diverse communities, what do you find tends to keep people from taking that first step?
Well, when clients finally find my private practice, they almost always say the same thing. I have been looking for months and I felt completely invisible. So maybe they decided to give the first step and then they start doing the research. Who can help me? And is when they start feeling totally invisible. Yeah. They don't know where to go. They look at the therapist for their insurance, but they don't feel names or they don't find names that feel safe. They don't find their language there. They don't see many times a people, a person face. Everything is online. So the system really makes it hard for us just to receive the treatment. Just to get licensed, as Mitra research mentioned, social workers, we have a really difficult test to pass to obtain the licensure. And most of the Latino candidates or BIPOC candidates have difficulties to pass the test in the first time. They need to try very, very many times. So that is an extra struggle because when they are looking in the panel with the insurance, they don't find us. Then also, when we pass the test, we are ready to start serving the community. We want to create our own private practice, specialized in service the community. We face challenges with insurance because usually they don't authorize or create new insurance. They like to work with big organizations with many therapists. And that's a challenge for us, as Mitra named in the research. Many times you can find a very good practice with many practitioners, but then it's only one people of color offering services. So how we independently can create what Pablo is trying to explain, this collective care, if we are the only ones in practice. So what I have been observing is that, well, we are here, we pass, but then we face the challenges when we are working with people. Also, another fear for the community is that they know that many times they are going to share their trauma, their sadness, but at the same time, they are in risk to be misunderstood, not only for the language, but also for the culture. So they need to explain and translate their sense of what is happening to the therapist. So instead of going directly to start therapy, they start educating the new therapist or using an interpreter in the middle. So that's a huge issue because they are not going directly to treatment. They are going directly to translate what is happening inside of them. Also, we know that many times the therapists are mandated reporter and we are afraid. The community is afraid of what if what I'm feeling, if I'm having anger issues, if I'm having different symptoms that can be misunderstood, then I will be called on the police. So it's not safe for me to be there and share my personal experiences. So I think it's not just to be ready, but once they are ready, they don't find an open door.
Thank you, Veronica. We have a question in the chat that I'll read to all of our panelists to decide who's best to answer. But from the question, thank you for sharing your insights and experiences. Can you reflect more specifically on the impact on the youth population in rural areas? thinking about both their vulnerability, given the sensitive periods of child development, but also their strengths and resilience. What changes in the system would better support youth? Thank you. Does anyone want to take that one?
I can take it. Before coming or relocating to the Twin Cities, I worked at a school district as the um, cultural liaison or Latinx liaison for the whole school district. And one of the things, like Veronica had mentioned, they needed a space to feel safe, um, because research has shown that people of color get called on and have mandated reported call on them at higher rates than their white counterparts. So that's an issue right there. And I remember one of the students, that was the first thing that she said to me, if I open up to you, you're going to call the cops on us. And I said, no, we criminalize poverty. So whatever experience they may be facing, they're quick to, oh, that's child endangerment, instead of understanding what was there, so that's one of the things. Also, it was really sad to see that in our community, in a span of 2 months, we had 3 suicides by youth in our community. And the first one happened during homecoming. And I remember being in that office and all of the students of color, trying to call home. Of course, their parents weren't around to be able to come and pick them up like other children would have had access to. And the mental health advisor told them that recommended to the school that they just needed to continue business as usual. And so it was a big contrast to see how the larger population, they still went and did their pep rally. They announced the coronation. And just to see that those children had just moved on while this student that was Latina had died by suicide. And you see all of the other kids trying to sit in my office because they didn't have a safe space, trying to call home, trying to figure out a way to just get away from it all. And so it's like, we don't address systemic racism. We don't address the mental health concerns that the children had. And that's a major problem. Students that, like Veronica had said earlier, if you are a person that experienced sexual assault from a male and you are female, you are not gonna give them a male therapist or a male doctor. But yet, when our children experience racial trauma, we have them go see a white therapist. And so you're not gonna feel safe to be opening up about your trauma, because many of the times that person is not even going to understand and misdiagnose your symptoms instead of identifying them as that's a symptom of racial trauma, and instead it's a behavioral issue. Um, so that's one of the facts. And then the other one, sometimes the children don't even have the language to express what that racial trauma was, whether that was some microaggression, whether they experienced tone policing. I knew that all those things were wrong, but I didn't have the language for it until I got to college and had my first teacher of color. So that's the other problem too, is that in schools we do not have enough teachers of color that can help and identify those issues and help the students navigate through that. And that's where I feel that we need to support the students as well too. It's like not just them, but educating the parents as well on resources for mental health, but also making sure that those resources are culturally sensitive as well. So making sure that you are that safe space for that student and that they know that they can come and that you have the support from the administration as well. So, because if you don't have the support from your superintendent, you're going to have some teachers that are not going to understand what you're doing and are going to try to attack what you're trying to do. But if you have the support and the trust of your administration that is going to back you up on protecting those children, that's going to be a greater win as well.
Thank you. There's another question here. I'll take another one from someone who is watching. The question is, how can we advocate for Native American families of Indigenous youth who find they cannot express their cultural identity at shared celebrations in the school setting? Does anyone want to answer that question? Able to answer that question?
Well, it is a state mandate for the schools to have a Native American liaison. So identify who that person is. And if you don't feel that the person that they hired is qualified to be holding that position, hold your school board accountable, hold the administration accountable, because they're receiving not just federal dollars, but also state dollars to ensure that the Native American students have the cultural support that they need to thrive in the schools.
Yeah, I think also part of the embracing the indigenous culture in our communities is to continue to provide events even outside of a school where indigenous communities are recognized and their presence is not invisible. And by the communities showing that presence in our communities, I think the schools are going to become more um, accountable to some of the services and openness that Katya is talking about. That yes, there is a mandate, but sometimes to break systems, we need to make sure that if it's not coming from inside the school district, the community is saying this is what we want our kids to experience when they are achieving these special moments in their lives.
Thank you. I'll go back to, I think that's all the questions I see right now in the chat, so I'm going to continue here. Mitra, how can cultural misunderstandings, based on in what you found in your research, how can that unintentionally create distance between providers and the communities they serve? Oh, you're on mute. You're on mute right now, Mitra. There we go.
Thank you. There are many answers to this question, but I think the one highlighted in the presentation where cultural traits are pathologized instead of being seen as adaptive cultural characteristics that actually provide support for people from communities of color, that's a big one.
Thank you.
Could I add to that, please?
For sure.
So I can give an example of that. So my mom, I was very fortunate to live, this is part of my privilege of where I grew up in a home where my mother was a social worker. So mental health has always been a part of my family. And I remember when my mom was going to school for her master's degree for social work and was working towards her license to be a licensed clinical social worker, she decided to use this, the services that they had at her university. And she came back so upset, fuming, she was visibly shaken, and she had to use her daughter as the person to help her through that process. And what had happened was she was in that person's office and she was openly talking about death. Now, we are from Mexico City. And if you know anything about our culture, this was before Coco became a big thing. For us to talk about death is something very normal, it's just a part of our culture. In fact, we even have a holiday to it, Dia de Muertos. So for us, it's not something taboo to speak about. So my mom was talking about, some experiences and the topic of death came up. The person that was doing her intake decided to put her on suicide watch because of the conversation that she was having and did not understand the cultural relation that we have with death. And because my mom, she had already been practicing social work for a while. She had been already doing it for 6 years and just decided to go back to school to get her master's, from her bachelor's to her master's, that she knew the system and knew how to fight that and be able to get out of being put on suicide watch. And she was just so upset. But here's the problem is that, first, that counselor did not understand you know, her cultural background. And if my mom did not know the system, that would have been detrimental and would have had to add more trauma to her life experiences being put with a diagnosis that would have impacted her career as well and her schooling. So it would have had a big snowball effect, but not everyone is as lucky to be able to have the language or to understand the system, to be able, sadly, to have to fight the system that is supposed to be there created to help you out.
Thank you, Katya. I think a follow-up to that, Veronica, I'd like to ask you, what in your work, what does culturally responsive mental health care actually look like, from the provider's perspective?
Well, from clinical perspective, culturally responsive care means practicing deep systemic humility. We must shift away from traditional Eurocentric model of therapy that only focuses on individual and instead view the client within their complete environment. Their distress is often a normal reaction to systemic racism and institutional barriers, not a personal failing. In practice, this look like three clinical shifts. And the first one is that we must lead with genuine curiosity about what the community actually finds effective instead of walking like in the textbook of the expert who imposes a rigid Western treatment plan. We must ask the client and their community what natural coping tools, traditions, and collective support system have kept them safe and resilient from generations. And we integrate those strengths in the healing process. And the second is that we must build systemic referral networks to actively support other BIPOC clinicians. When we cannot serve a client and we don't have the right cultural match, we must have an active, warm, hands-off referral list instead of letting the BIPOC clients' health deteriorate on months of long waiting list. We must actively direct them to independent BIPOC clinicians who have and can serve them immediately. This strengthens the entire mental health ecosystem. And in here, well, we will need to introduce the virtual care for rural communities. And third, well, yeah, that we need to shift the clinical lens from individualism to collectivism. Western clinical models prioritize individuals' boundaries above all else, but culturally responsive care respects that what for many cultures of color is a collective unit. The extended family, the community ties, those are their primary protective factors. And we must honor and integrate those relationships rather than pathologizing them.
Thank you. We do have a question in the chat. I apologize if I had missed this a little earlier, but just trying to get to where the question starts. It says, I do need to read the report. It may be in there, but clearly communities of culture are not a monolith. What common denominators have you found? Also, is there a need for psychoeducation tools in addition to therapeutic resources? Does anyone feel best to jump in and answer that question, or a few of you?
I'll address the first part of that. Just underscoring the importance of let's say, underscoring the limits of any terminology like BIPOC, communities of color. This is grouping an incredible diversity into, trying to cover it with one term. There is no monolith. Just as Norwegian culture is is unique from German culture, is unique from Italian culture. So is Somali culture unique from Latinx and Hmong and Karen. And we need to recognize the limits of the terminology that is being used, which is a Western construct, which is a very white culture construct to try and just group together things that are not the same.
All right, I'll continue moving on. This is an interconnected discussion, so we're really looking at issues that impact both rural and greater Minnesota. Pablo, what do people in greater Minnesota, do you think, misunderstand about the experiences of communities of color, these residents living in rural communities?
Well, I think the misunderstanding have been already answering some of the barriers that we have been pointing out in the last an hour. So I think that the fact that some of those misunderstandings are also what Mitra just mentioned, is that we get grouped, and the diversity within communities, cultural communities, we are unique, right? So we need to be curious. We need to ask questions about the origins of the clients that many people will be serving. And it almost feels like in all sessions, in all approaches to mental health services, like Veronica was mentioning, we need to have a time to get to know the individual, not through a survey, not through a piece of paper where you are checking boxes, but rather have that verbal conversation and interpersonal. People from other parts of the world come from a very communal environment. Community is very important, it's crucial in cultures outside of the United States. I think this country and the culture in this country has become very individualized. It's very individualistic, and we need to make sure that when we deal with mental health, we need to start bringing back community into part of the healing process. And that is offering a sense of belonging, because that's something that many times people are missing in their journey of mental health. We talk about isolation, fear, anxiety. Some of the conversations that need to pop up in those moments is how could a person find a sense of belonging in our communities, in their circles, in their networks. So I think that's part of the equation as we talk about the misconceptions.
Thank you. Katya, people may frame rural issues and racial equity issues as separate conversations, but why is it important to understand where those experiences overlap?
Racial trauma happens everywhere. Systemic racism is in every fabric of this country. You cannot escape it. So even when we do increase teachers of color, providers, mental health providers of color, if the system is still there, the oppression is still going to happen. And so until we change that, because I've had to experience it. And again, because of the privilege that I have of having a mother that understood the systems. And I tell folks that I have my honorary degree in social work, because whenever she did her papers, I was the one to be proofreading them for her. So, and she graduated with her 4.0. And so, but yet, whenever I needed the care, and this was now even when I continued my care, my mental health care here in the metro area, when I needed a letter, the new policy that new healthcare facility had prevented that. And the policy was there created to protect the organization, not to protect or be in the best interest of its patient. So even though I had a mental health provider of color, she was also very frustrated at the fact that the system had tied her hands to fully provide care for me as I was experiencing racial discrimination and PTSD in a toxic workplace. And so it doesn't matter where I was, here I am now in the metro experiencing PTSD from a toxic workplace. And it didn't matter that, you know, whereas when I was in Northwest Minnesota, that in order for me to get the help that I needed to first educate my therapist on on issues that were related to racism and racial trauma, and to the point where she couldn't detach herself and started crying because of the things that I had to go through. So she couldn't even be that professional to where now I was the one having to like tend to the fact that she was feeling either the guilt or whatever of what racial trauma was, and not still being fully able to provide the services that I need. So the services have always been half um, because of that. And so can you repeat again? Because I feel like now I am rambling.
Yes, I'll go back to my question. I was saying that why is it so important to understand where rural issues and racial equity issues overlap?
So that's where I feel that they overlap, is that the fact that whether you have representation, if those systems are still in place, the oppression is still going to happen, whether you're in greater Minnesota or even here. And, now that I've moved, I still get phone calls or folks reaching out from greater Minnesota, from the Somali community, from the African community, of asking, because we are all a collectivist um, culture, we come from collectivist cultures, is that they know and trust. And so many times, it's through word of mouth of who you trust, of who is a safe space to go to, or what agency, or which ones to avoid. And so even now that I'm here, they know the lack of representation or of access to mental health care over there. And so they tap into like, what resources do you have down there that I could go to that would be safe for me? So that's the other thing too, is like just because we have a greater number here of um people of color that are licensed doesn't mean that they are accessible either, because we still have the other barriers of um, being able to afford it if you don't have the proper insurance, and paying it for out of pocket is also very expensive as well.
That was actually, thank you, Katya. That was actually my next question for Veronica. Veronica, is there anything you want to add on to that? I was going to ask you, that people do often assume because there are more providers in the Twin Cities compared to Greater Minnesota, that access must be a lot easier. Um, is that true for individuals and families seeking care? But it sounds like that's not always the case.
No, yeah, that's not always the case. Yeah, I think as Mitra named in her research, the bottlenecks are everywhere. As Katya was saying, the systemic racism, the discrimination is everywhere. You can find it in the waiting list, you can find it in insurance companies, uh, you can find it in the primary care providers that are observing the distress that our people is suffering, and they have to invite them to take therapy in their own clinics, and maybe they only have one clinician that is able to provide the cultural sensitive care, and they stay there for months. And again, if you have a client in waiting list suffering for months, that is not providing care.
I'd like
And
to
also the way that the insurance companies have incentivized this as well, whereas a provider that isn't of that culture or has that language, they're able to put in more codes and bill insurance if they need someone with the language, if they identify or have labeled this as a high level or high stress case. So there's always all of those, whereas someone that knows the language isn't going to need to put a language code to be receiving interpreting services or another code because they're in a greater area. So that's also something that disincentivizes a lot of the licensures of color, the therapists of color, to even want to deal with the insurance companies, just because also the way that they code their billings as well.
Mitra, did you have something else to add as well?
Yes, and it's stepping a couple moments back into the original question asked and also segueing from what Veronica and Katya have shared. Something that I heard in interviews more than once for sure was it's about the self-reliance element of cultures in rural Minnesota. Specifically, rural culture highly values rugged stoicism and self-reliance. And when you overlay this rural cultural expectation onto a community of color that's already experiencing added pressure of cultural isolation, or systemic racism, which I'm very glad has been brought up several times, the barrier to admitting a so-called weakness becomes multi-layered. It's a further compounding effect.
Mitra, are there any ways rural and urban communities could learn from each other, based on the research or what you learned?
Certainly. Excellent question. I wish I had some examples off the top of my head. But I mean, the big takeaway, one of them from this study, is that community-driven solutions are the way to go. That models of community care, mental health care, but also expanding just holistic mental wellness, overall wellness, when these solutions and programs are innovated by the cultural communities that they are intended to serve, they work better. And so you've got cultural communities, language communities in urban and rural settings that are experimenting, innovating, finding successes, learning, and those cultural communities can certainly share wisdom between them, between urban and rural settings, and perhaps even between cultures. Because as Pablo and Veronica and Katya have all noted, this collectivism focus of 80% of the world's cultures is true, across many of the cultures we have represented in Minnesota, including rural Minnesota.
Thank you. And I saw there was a question in here. Just give me 1 second while I try to find it. Question in the chat is, what are some of the shared values that you see between Western traditional approaches versus non-traditional holistic pathways in the perspective of both providers and clients or individuals?
I may not be directly into the mental health sector, but I think from a community leader perspective, I know that faith experiences or spiritual experiences are much part of the values of most cultures. And so if you have immigrant communities or if you have indigenous communities who have been here longer than anybody else here, I think spirituality could be one of those key values and factors that will lift that common ground in terms of Western perspectives or systems and compared to some of the immigrant or indigenous groups. So if we can somehow find a spirituality role in the journeys, as we talk about holistic approach, like I've been saying today, it will add to part of the solutions.
I want to make sure we talk a little bit about potential solutions and strategies. So let's talk more about that. Veronica, what changes do you think would make the biggest difference uh, for communities of color and these families?
Okay, well, to make real difference, we have to stop trying to fix the client and start fixing the system. There is three systemic changes that will completely transform access for BIPOC families. One will be that we must require insurance companies to cover traditional healing practices. The Western talk therapy is not the only way to heal. We need insurance to recognize and reimburse traditional cultural rooted practices that BIPOC communities have used naturally for generations. Also integrating these practices into the formal treatment plan that honors the community natural protective factors and makes therapy feel truly safe and relevant for them. Another one will be that we must create clear licensing pathways for international trained clinicians. As Mitra said, we need to do more research. I agree that maybe this is a way that we can increase the amount of professionals taking care of BIPOC communities. Because we have immigrant professionals living in Minnesota who already have advanced degrees and specialist training from their home countries, but yet our licensing boards have massive walls to keep them from practicing. And by creating a pathway for these experienced immigrant providers, and they can obtain their licenses, we can instantly expand our bilingual and bicultural workforce. Also, we must implement integrated behavioral health that includes a warm hands-off. When a primary care doctor, when a urgent care identifies that a BIPOC patient is struggling with mental health, they don't have to force, the clinician don't have to be forced to be referred only in the corporate system. We need to integrate to create a database that can connect the doctors with clinicians that are BIPOC and that are ready and have spaces to serve the community. If it's in rural areas and they don't have physically a location, maybe to refer them to provide virtual care, where it will be easier for them instead of driving many hours to receive the care that they need.
Thank you, Veronica. Pablo, how can local governments and community organizations play a role in supporting mental health and well-being, even if they obviously are not healthcare providers themselves?
Yeah, so like I said, I think most communities are trying to build a strong communities, especially when we talk about communities outside of urban areas. We're trying to um, be a place of welcoming and belonging. Um, and many times a conversation about these two issues ends up being a very economical conversation, meaning, well, we are happy BIPOC people are here because they are providing and contributing to the economic development of our region or state. Well, that's great. Put a dollar sign on our forehead. But I think the conversation about welcome and belonging needs to shift from us contributing to the economy and people can see us as a whole human being again, and making sure that our mental health is also the key reason why our communities will continue to grow. So we need to make an investment on making sure that we do almost like a wraparound um, effort where different sectors of our community come together to talk about mental health and say, how do we uh, walk with our new neighbors in this journey? Instead of just finding ways, how do we make money from these neighbors, how do we now provide a mental health solution for the concerns that we bring? One of the big issues that I don't think we have talked about is that new immigrants have come with a lot of trauma already embedded in our lives and in our mental health. And let's not forget that there's major trauma already. Whether we like to accept it or not, most of us have experienced that. So if we find solutions together, from my perspective, our communities will continue to be a stronger community into the future.
Thank you. Katya, where do you think investments and attention should be focused first in Minnesota?
Oh, I feel in legislation, if we want things to change, I know in 2023, a bill passed to make it more accessible to increase the folks of color. We had a shortage of social workers, so they reduced where they allowed other folks that had their license from another state to be able to practice here in Minnesota. So there's some ways to be able to do that. Also, the way that we get the licensure is very problematic, especially in greater Minnesota. So one example, like I had mentioned, my mom graduated with a 4.0 GPA in her master's program, and it took her 5 times to pass the licensed clinical social worker. And the thing is, it's not just, oh, you just, you have to just retake it. She was in Northwest Minnesota, so that means that she had to take time off from her work to drive down to where the testing site is. And then if you pass, you have to wait 6 months to be able to retake the test. So imagine how long it had to take her to be able to take this test. And there was something that we saw similar with the teaching licenses, where many of these teachers had already been teaching for 6 years in our school districts or had been professionals back home, but yet the only part that they could not pass was the test. And we had a teacher that was an ELL teacher in second grade, and the part that he could not pass in, and he had his master's in psychology, had been teaching, but yet in the test they were testing him on US literature, and that was the part that he kept getting stuck, which had nothing to do with his teaching. So it's also looking at what is in those tests for social work as well, and are they also, which I would not be surprised if the research found that the material that they are testing on has cultural connotations that would already limit or make it even harder for folks that are not white middle class females, because that's also who predominantly has those licenses. So seeing how those barriers are not for them, but are created for everyone else. So I would say legislation would be the main one that I would focus on to make sure that the state is investing in mental health. Just recently, this past session, Representative Perez Vega had a bill to allocate funds for mental health for folks that were impacted by the Metro surge, and that did not pass. So that's the other thing, is like, once we do have the bills that pass, making sure that folks know what legislation has passed and what is available for them to be able to get their licensure, and if there is funds also once available to be able to provide those services. So I feel that it's both of those things. Once we advocate for those pushes, and once they do pass, how do we educate others to bring awareness to what is available for them as well?
Katya, a follow-up to that for people watching today who really care about this issue. What is one thing or an action people can take right now to improve the situation? If they feel like, how can they get involved?
If you are a parent, find out if your school receives funding for the achievement and integration program, because that is state funding. That's a state program where the schools get funding to make sure that they are addressing the needs of students of color. So that would be the first one. And if you're not, and if you are, if your school is identified and is on that list that is receiving those funds, they're supposed to be providing their goals. And they're also supposed to have a parent or a group that is advising how those funds and how the school addresses those goals. So get involved in that. Find out what is your school district doing. And if they're not doing what they're supposed to, put the pressure on the administration and the school board because they're there for that reason to be advocating for you and your family. The other would be find out who is your representative and elections are coming up. Find out who's running for elected office and what are their issues. And if you're not comfortable calling, send that email, send a letter, connect with your legislators at the local level, because I strongly believe that local elections do matter. And so this is going to be really important for you to find out what are they working on and are they addressing the needs of your community? And find other ways to get involved through coalitions as well. Also, we are very fortunate in the state of Minnesota where we have ethnic councils. We have three ethnic councils. We have the Minnesota Latino Affairs Councils. We have the Council of Minnesotans of African Heritage, and we also have the Council for Asian Pacific Minnesotans. And we also have they are not considered an ethnic councils, but they do work alongside with the ethnic councils, which is the Council for Native Americans as well. So we have those four councils here in Minnesota that are part of the executive branch and that they work on issues that are pertaining to the communities. And mental health is one of those issues that you need to bring up to them, and they will help you to either track bills or write a bill or do the work that needs to be done to make sure that the needs of your community are being heard and are being heard not just by their council, but the responsibility is to advise the governor's office and both the House and the Senate, regardless of who is, whether it's GOP or DFL, they work across both party lines.
Thank you. And I think Veronica, I'll ask you, I think this will be our final question. What is one thing you hope people will take away from this conversation today? If they remember one thing.
Oh, I think that is relevant to see that three of the panelists are BIPOC, and we are really trying hard to support the community. So I will be happy if you take something from us with this intention to improve Minnesota, to support the growth of the community, and you join us and find in your specific area what you can do to support BIPOC community, how you can integrate systems to respond their needs, not just expecting in the legislation to do something, but to do something in the area where you have influence. And that's how we can collectively create a movement to improve the mental health of all of us.
A great closing note. Thank you so much, Veronica. And before I turn things over to Jake Loesch to close things out, I'll thank our panelists, Mitra, Engan, Pablo, Obregon, Katya, Zepeda, and Veronica Rivera, and Mitra also for the presentation at the top. Thank you so much for your time, and I will turn things over to Jake.
Thanks, Kate. And thank you, all of you, first of all, for joining this webinar. I want to second the gratitude to Mitra, Pablo, Veronica, and Katya for your insights and for walking us through your work. Thank you for your work, first of all. I think some really important takeaways here. And I hope this conversation was interesting. We will be sharing this online, both on our website and via email. So if you take a look, be on the lookout for that. You'll get an update with the link from us soon. I did just want to share a little bit about our organization as well. So I am the executive director of the Citizens League. We have partnered with Center for Rural Policy and Development on this program, as Julie said at the top, for about the last 5 years or so. And each one of these conversations is fascinating. I think we always learn something, and I hope that you take something away, as we were talking there at the end, something that you can do, whether it be an advocacy role, a conversation you can have, a legislator, an elected official that you can reach out to. I think what's clear from this conversation, and we probably all knew this going into it, but that access to mental health care is so critically important now more than ever, but that we have an enormous amount of barriers that remain, especially for residents in rural communities and those who identify as BIPOC. We have a lot of work to do. I think we've heard about that here today. We've heard some of the difficult stories and challenges of how it can be to access mental health care and treatment for you, whether it be finding providers or navigating the system. Each of us brings a different challenge, but the importance of that mental health care and access and providers so critically important. And I think we have to look at how we can make that much more culturally responsive all the time. Thank you so much for being a part of our Interconnected series. Stay on the lookout, subscribe to our email newsletters for Center for Rural Policy and Development, and for us at Citizens League. We look forward to future events. Thanks for your time, and have a great afternoon.